Mosquito Day is commemorated tomorrow. And there still is a lot of confusion between dengue and malaria. So we thought it would be appropriate to host this conversation on how to differentiate these mosquito-borne diseases. I'm Eloine Barry. I'm the founder and CEO of African Media Agency and ALMA Academy, and I will be your host for the day. So we have quite an interesting program today with great speakers. I will not spend too much time talking, but I would like to introduce our speakers and to tell you what we will be discussing today. So the opening remarks will be delivered by Dr. Michael Charles, the CEO of RBM Partnership to End Malaria. Thank you so much, Dr. Charles, for being able to be part of this webinar. Then we will hear from Krystal Birungi, who's Field Entomology Coordinator at Target Malaria, Uganda. Krystal, welcome. Thank you so much for being here. And Krystal will talk to us about the differences in mosquitoes, their biting habits, along with the African-led innovations that are being developed on the continent to end malaria. Thank you, Krystal. Then after Krystal, we will hear from Dr. Charles Guissou. Hello, Dr. Charles. Thank you for being here. Hi. So Dr. Charles Guissou is co-principal investigator at Target Malaria, Burkina Faso. And today he'll talk to us about give us some scientific insights for you to gain a deeper understanding of the biology of malaria transmitting mosquitoes. And last but not least, we'll have Dr. Phillip Chigiya. Hello, Dr. Phillip. Dr. Phil, who's the secretary of the African Leaders Malaria Alliance Youth Advisory Council. And Dr. Phillip today will talk to us about, how we can debunk some misconceptions and misinformation. There's lots of fake news going on and, fake understanding of the diseases. So he'll be here to explain to us the differences. As always, we'll leave room for Q&A at the end of the presentation. So please make sure that you use the Q&A button. And let's start. So we'd like to start with a bit of a game. So now let's test your knowledge. I know quite a few of you journalists present today have been taking part in our boot camps that we hosted in the past, and you've been very engaged in everything that we share with you. So thank you so much. But now let's see, and let's test your knowledge. I will ask JV to bring up the poll. There's no prize, just so you know. So the first question is, I'm being told that I'm going too fast, and there is actually the introduction from Dr. Charles from RBM. Please, let's listen to this now.
World Mosquito Day. On the 20th of August every year, we commemorate and reflect on the mosquito and the havoc that it's having on many parts of the world, many parts of the various continents that we find ourselves. Specifically on the African continent, the mosquito continues to cause havoc that it has been causing for many years. We're looking at the mosquito and malaria specifically, as well as dengue, in terms of the economic impact it's having. We see when we go to the clinics in the communities, we see that whether it's malaria or dengue, we see that it is mainly women that are being affected because their children are in the hospitals and they have to stay with them. This is loss of productivity, loss of income. And we actually did a study recently where we found out that if we're able to reduce the malaria burden by 80%, we would have an increase in GDP by 2030 of 127 billion. This is quite significant and results in about 16 billion annually. We're calling on you, journalists, to help us in this narrative, to help us to be able to showcase the intersection between mosquito-borne diseases, be it malaria, be it dengue, together with other intersections, be it gender, be it infrastructure, be it the climate crisis. We need to do something about it. We need to continue to invest in our communities, and we really need you to support us in that call to say, let's do it together. As the humanitarian sector, as the development sector, as global partners, we cannot do it alone. We count on your support, and I really wish you good deliberations in this meeting, and I hope that we'll be able to count on your support as we move along in trying to eliminate malaria as well as dengue. Thank you. Good morning, good afternoon, good morning.
The figures are staggering still. So I think the message is clear. We count on you journalists to carry on the help. We need help. We always need partnership, and we need you to make sure that local populations understand the work that needs to be done. It's a collaborative effort. So let's go back to our game. We're going to test your knowledge now in a quick poll. I'm going to ask for the poll to be pulled up, please. So the question is, do you know how many species of mosquitoes exist globally? 100, 756, 3,500, or 6,501? The results are coming in. I'll give it 30 more seconds for you to cast your votes. We have a tie. Okay, so 44% of you think that 100 species of mosquito exist. Oh no, it's changing. Okay, we're done. All right. 50% of you think that there are 3,500 species of mosquitoes. Send the poll now and let's see the results. So this is correct. There are 3,500 species of mosquitoes, out of which 837 of those are in Africa. And out of these 837, 3 species are responsible for most transmission of malaria in Africa. Thank you. We have a second one. And I will pull up the image. And the question is, can you identify the difference between a male and a female Anopheles mosquito looking at this image? Is it A or B? Which one is the female? Is it A or is it B? Okay. Very good. 67% gave the right answer. This is correct. The photo A is the female. And I will not spend too much time because you basically know, but yes, the female mosquitoes are larger than the males and they have a more needle-like proboscis, which they can use to bite. Thank you so much for participating. Now let me leave the floor to you, Krystal, who will talk to us about identifying the differences in mosquitoes. Thank you so much.
Thank you, Eloine. My name is Birungi Krystal. I'm the field entomology coordinator at Target Malaria, based at the Uganda Virus Research Institute. Next slide. So today I want to talk to you about the different types of mosquitoes. So the groups that you can see on the screen here, at this level, we call these groups genera, different genera of mosquitoes. And within those genera, each genera has many species. So these are just a few of those that you can find in the world today that are medically important. You can see on the screen the Aedes, the Culiceta, the Sorophora, the Toxyrhynchitis, the Anopheles, and the Culex mosquitoes. So for the purpose of the talk today, we are going to focus on two of these genera, which is the Anopheles and the Aedes, because these are some of the most medically important mosquitoes in Africa today, and arguably even worldwide. Next slide, please. So what are the differences between an Aedes mosquito and an Anopheles mosquito? Aedes mosquitoes are what we famously call the tiger mosquito, if you've heard of that, because of the very, very visible stripes on the mosquito. So it has white stripes down the center of the thorax. And when they rest to bite, their resting position is the abdomen is parallel to the ground. So it would be form a parallel line to the surface on which it is feeding. Their wings have distinctive white markings, and you can easily see this even with the naked eye. You don't need a microscope to see those white bands that are on these mosquitoes. But when you look at the Anopheles mosquito, you will find that they hold their abdomen at a 45-degree angle to the surface on which they are resting. So it will look like their bum is in the air, to put it simply. They have long palps, and their coloring does not have that distinctive black and white that you can see on the Aedes. Rather, most of them are varying shades of brown. Next slide, please. So the other marked difference between these two at the moment is their behavior when it comes to biting. So the mosquito, the Aedes mosquito, is famous for transmitting a few diseases. Among those are the yellow fever disease and a disease called dengue, which is one of the ones that we're looking at today. And this mosquito bites in the daytime, chiefly in the daytime hours. So you'll find it biting throughout the day, and then majorly or most frequently in the early morning, at dawn, and at dusk. While the malaria mosquito, or the Anopheles mosquito, is actually a nighttime biter. So the behavior of this mosquito is that it prefers to bite people during the night. And this is why we come up with control measures like mosquito nets, because you will expect that by the time this mosquito is most active, people would be under mosquito nets. So that is why that came up, because we know that this mosquito prefers to bite late in the evening and at night. So while mosquito behavior does have some changes that happens over time, this still remains the key features of the biting behavior between these two species. Next slide. They also differ when it comes to their preferred habitat. So there are many species of Aedes, just like there are many species of Anopheles mosquitoes. So some Aedes mosquitoes are indeed domestic species, in that you will find them around human households, while others actually prefer living in the woods, and you'll find them mostly in forests. However, malaria mosquitoes, the Anopheles mosquitoes that spread malaria, are mostly hanging around households. They rest indoors inside people's houses, and in general, and they also prefer rural areas rather than urban, where there's a bit less pollution, the water is cleaner and fresher. Apart from the there's a species that has been migrating recently called Anopheles stevensi. It was very common in Asia and now has been spreading and has already spread to parts of Africa. So that mosquito species, that Anopheles mosquito species, is more urban. It does prefer cities. So there is quite a danger to malaria control when mosquito species start to migrate to different areas. Also, you will find that certain Aedes species still prefer to live outdoors, while a lot of Anopheles species actually prefer to be indoors. Next slide. So one thing that's really important to note is that we have about 150 million years of evolution separating Aedes and Anopheles mosquitoes. So these mosquitoes cannot mate to one another. You will not find an Aedes mosquito and an Anopheles mosquito having any offspring because they are too different now for that to happen. Next slide. All mosquitoes share the same life cycle. So this is basically the stages they go through in their lifetime, or you'd call growing up. So mosquitoes lay eggs on water surfaces, and those eggs hatch into a stage we call larvae. That stage is aquatic, so it's in water. And after molting a few times, that stage becomes pupa. After the pupa is formed, then the next stage is the adult. So the mosquitoes will emerge from that pupa and they will fly, and then that's when they start to look for food, and that's when you have the stage that can actually spread malaria. Next slide, please. I will now pass to next speaker.
Thank you, Krystal. Thank you so much. This is very, very useful. I will now leave the floor to Dr. Charles Guissou, co-principal investigator for Target Malaria in Burkina Faso, to talk to us about the differences between the diseases.
Thank you, Eloine. It's a great pleasure for me to be in this panel with great panelists. I'm going to walk you through the difference between malaria versus dengue and the similarities, so to better understand how to recognize those diseases, to differentiate, diagnose, treat, and prevent them. So mosquitoes are vectors to a certain number of pathogens that transmit a certain number of diseases that are called mosquito-borne diseases. Some include, but not exhaustive in this table, we have Aedes, we have Anopheles, we have Culex. Common diseases that are transmitted by these three types of mosquito are, if you look at, for example, Chigiya, which is a viral disease transmitted by Aedes mosquitoes, causing sudden onset of fever, joint pain, and rash. It can be found in Africa, Asia, the Indian subcontinent. Dengue, which is not new, is a mosquito-borne viral infection caused by the dengue virus, leading to high fever, severe headache, and joint and muscle pain, rash, and bleeding in severe cases. Most of the time, dengue is found in tropical and subtropical regions, especially in urban area. Lymphatic filariasis, which is a parasitic disease caused by a microscopic worm and is transmitted by also mosquitoes. It can lead to lymphatic system damage, like a swelling and elephantiasis. It can be found in sub-Saharan Africa, Southeast Asia, and the Indian subcontinent. The Rift Valley fever is a viral disease affecting both animals and humans. It's a zoonose transmitted by mosquitoes or contact with infected animals. It may cause fever, liver abnormalities, and hemorrhagic symptoms in severe cases. Yellow fever. This is a viral hemorrhagic transmitted by Aedes mosquitoes, causing fever and bleeding, and can be fatal in severe cases. Zika virus. is a viral disease transmitted by Aedes mosquitoes, often causing mild symptoms like fever, rash, and joint pain. Then malaria, which is a life-threatening disease caused by Plasmodium parasites transmitted through the bite of infected mosquitoes, Anopheles mosquito, characterized by fever, chills, and flu-like symptoms. And then we have the Japanese encephalitis and the West Nile fever that are transmitted by Culex. Next slide. What are the main difference in terms of transmission dynamics? The main difference between malaria and dengue in terms of transmission dynamics start with the pathogen and the vector. Malaria and dengue are two very common vector-borne and mosquito-borne diseases in certain parts of the world, meaning that they are both transmitted by mosquitoes. These diseases can also be present in the same countries, which can be problematic if there is an outbreak of both diseases at the same time, like what we witnessed last year in 2022 with the outbreaks of dengue and the malaria epidemic also. Dengue is caused by the dengue virus, which is transmitted through the bite of an infected female Aedes mosquito, while malaria is caused by the Plasmodium parasite, which is transmitted through the bite of an infected female Anopheles mosquitoes. Anopheles are common in rural settings, primarily in Africa, Southeast Asia, and South America. Dengue is more widespread in tropical and subtropical regions. Both malaria and dengue are transmitted by female mosquitoes and can cause severe fever in humans. Because of this similarity, they can be confused by patients, by local communities, and even by the medical staff. However, there are two very different diseases caused by different pathogens and different mosquito species, Aedes for dengue and Anopheles for malaria, and they don't meet. Next slide. Symptomatology-wise, the main difference between dengue and malaria, when you look at dengue, the incubation period varies between 4 to 10 days after a mosquito bite. Symptoms can be high fever, headache, body aches, nausea, and rash. And in some cases, like severe dengue, hospitalization is required. While malaria symptoms start within 10 to 15 days after getting bitten by an infected mosquitoes. Symptoms can range from mild to life-threatening. Mild symptoms are fever, chills, headaches, and also sometimes when it's severe, you may have fatigue, you can have confusion, seizure, and difficulty breathing. What are the key differences in clinical presentation? Both of those diseases, they have fever. But when you look at in malaria, fever is often cyclical, meaning that it goes up and down, corresponding to the parasite life cycle with interval of chills, high fever, and sweating. While dengue, the fever is typically continuous and high, often lasting 2 to 7 days. We might have also rash. Rash is uncommon in malaria, but in dengue, rash can be common, appearing after 2 or 5 days after the beginning of the disease. And we may have also bleeding tendency. Malaria, there is no bleeding unless it is a severe case, for example, the cerebral malaria. But dengue, bleeding is more common. You can bleed from nose, from gum, and also from the skin, especially in severe cases. The pain. In malaria, generally, we have muscle aches, pain, often less severe than dengue. But in dengue, we have severe muscle and bone pain. Next slide. Okay. Dengue is caused by a flavivirus. we have different type of virus. We have then 1, then 2, then 3, and then 4. Those viruses are called serotype because each has different interaction with the antibodies in human blood serum. Recovery from infection by one provides lifelong immunity against that particular serotype. However, cross immunity to the other serotype after recovery is only partial and temporary. Subsequent infection by other serotype increase the risk of developing severe dengue. The disease is usually called dengue fever. Sometimes it's referred to bone break fever because of the symptom. Next slide, please. Next slide, please. Okay, malaria. In malaria, we have 5 Plasmodium parasite species that cause malaria in human. And 2 of these species, especially the Plasmodium falciparum and Plasmodium vivax, pose the greatest threats. Plasmodium falciparum is the deadliest malaria parasite and the most prevalent on the African continent, while Plasmodium vivax is the dominant malaria parasite in most countries outside of sub-Saharan Africa. The disease is called malaria. Next slide. Please, no. The prevention and treatments. When it comes to dengue, there is no specific treatment for dengue, but appropriate medical care save the life of patients with severe dengue. So we need early detection of warning sign, and access to proper medical care can lower the fatality rates below 1%. In malaria, we have anti-malaria drugs which are available that can reduce the disease, prevent death, and contribute to reducing the transmission. So the WHO recommend that all suspected cases of malaria be confirmed using parasite-based diagnostic testing through either microscopy or rapid diagnostic tests. Malaria is a severe infection and always requires treatment with medicine. In terms of prevention, dengue, up to now, the main method of controlling and preventing dengue virus transmission is to combat the vector mosquitoes using environmental management, source reduction, and chemical methods. We also need community support, which is essential to sustain control measure. For malaria, vector control remain a vital component of malaria control and elimination strategy, as it is highly effective in preventing infection and reducing disease transmission. The 2 core interventions are the bed net, the insecticide-treated bed nets, and also the IRSS, the indoor residual spraying. Next slide. So, in terms of numbers, the global incidence of dengue has grown dramatically in recent decades. We have reported case by WHO, which increased from 505,430 cases in 2000 to 6.5 million in 2023, which means an increase of more than tenfold. In year 2022, Africa was home to about 94% of all malaria cases and 95% of deaths. Children under 5 years of age accounting for about 78% of all malaria deaths in Africa. It means that every year we have about 200 million cases of malaria, resulting in almost 500,000 deaths annually. And malaria not only kills people, but devastated economies and leaves many of its survivors with long-term health problems.
Thank you so much, Dr. Charles. Thank you.
Thank you.
Thank you. Just a quick reminder for our journalists, please feel free to start typing your questions in the Q&A chat so we can respond to them as quickly as possible. Thank you so much, Dr. Charles. I will now leave the floor to Dr. Phillip Chigiya to talk to us about dispelling myth between dengue and malaria. The floor is yours. Thank you.
Thank you very much, Eloine. Good morning. I will be presenting on dispelling myths between dengue and malaria. So the first one is that malaria is caused by bad air. And where we get the term malaria, we actually get it from, and it has Italian roots, and the mal part of it means bad, and the air just means air, as we call it today. So put together that mal air, it was from the belief that malaria was caused by dirty air, which was coming from the swamps historically. But with the advancement of science today and what we know that malaria is caused by a plasmodium, which is transmitted by the female Anopheles mosquito. So malaria is not caused by bad air, but by a plasmodia transmitted by the vector of mosquito. The second myth that is quite prevalent when it comes to dengue and malaria is that malaria can be transmitted from one person to another. So the truth is that malaria is not contagious and cannot spread directly from one person to another, as what happens in a cold or flu or what happened during COVID-19. It is transmitted through the bite of an infected Anopheles mosquito. And this is the most prevalent way of transmission of malaria. So, which is very important for people who live in malaria endemic areas to protect themselves from a bite. And from time to time, which are rare cases, I must emphasize, is that it can also be transmitted by blood transfusion. But fortunately, our blood banks these days, they actually do test and make sure that the blood is clean and not infected with malaria before it is given to the other person. And rarely we get mother-to-child transmission, but the WHO recommends getting women who are pregnant to get preventative methods, and that has been declining with time. Then the third myth that is also quite prevalent is that only poor people get malaria. And it is true that malaria is prevalent in low and middle income countries, and that's where the majority of deaths actually occur. And malaria, in some instances, it has been termed a disease of poverty. But malaria, as I said previously, it is transmitted by the vector. And anyone who is bitten by a mosquito which is infected and that can transmit malaria can get malaria. And actually, in high-income countries, from time to time, we get cases of malaria being reported there. So malaria can infect anyone, and it is not a disease only of poor people or low-income people. Then zoning in a bit on dengue, also people think that dengue it only occurs during the rainy season. But it is very true that in the rainy season, that's where we have the majority of cases, just because the vector, the mosquitoes are breeding more and more, is how Krystal elaborately explained it earlier. But throughout the year, in subtropical and tropical areas, we can get transmission of dengue in these areas. So it is important for people to have preventative measures at every time of the year if you live in a dengue endemic area. The fourth myth is that mosquitoes that transmit dengue only bite at night. Krystal explained earlier on that the Aedes mosquito that spreads dengue, they are day biters, and their peak activity is during dawn and dusk. This is different from the Anopheles mosquito, which is very active at night. So because they are day biters, dengue can also be transmitted by these mosquitoes during the day. So it is very important that people who live in dengue endemic areas take the preventative measures even in the afternoon. So that's wearing long sleeve clothing, and also those who have screens on their houses to have them active even during the day and not just at night. The last myth that I want to address is on the papaya leaf juice. And this is actually pretty common, is that papaya leaf is a guaranteed cure for dengue. As what Dr. Charles was explaining earlier on, dengue, there is no treatment for dengue, but but healthcare is very important to access during that time. And some people believe that papaya leaf juice can increase the platelet count and decrease the bleeding that happens when someone is infected by dengue. There is no conclusive scientific evidence to support this claim. So it is important that when someone has got dengue or is suspected that they have dengue virus, it is important that they go and seek proper medical treatment. And papaya leaf juice alone is not a guaranteed cure. May you kindly move to the next slide. So just to tie it up, both malaria and dengue are transmitted by female mosquitoes, and they cause severe fevers in humans. Both diseases present with fever. And because of this similarity, it is quite common that patients and also practitioners sometimes, they find it difficult to distinguish between the two. But it is important that whenever you have a fever and you're suspicious of either of these diseases, you get treatment at a medical facility. Can you just move to the next slide? And we just have pictures of the Aedes and the female Anopheles mosquitoes. So lastly, and to conclude, I would like to conclude by saying dengue and malaria are two very different diseases, and they are caused by different pathogens, and they are transmitted by different mosquito species. The Aedes mosquito transmits dengue, and the Anopheles mosquito transmits malaria. And it is quite common that misdiagnosis between the two diseases happens, and it is also to have co-infection of both diseases. Thank you very much.
Thank you so much, Dr. Phillip. Thank you. We will run really quickly through the innovations with Krystal, but please, can I ask everybody to send your questions in the Q&A so everybody can see them, and we can make sure we answer the right questions from the right channel. Thank you so much, Krystal.
Thank you, Elohim. Yes, so I will briefly talk about some of the innovations that are coming up to fight malaria. So we have had a dire picture, but there is hope. So one of the things that I'm sure we've all heard about are some new malaria vaccines. These have been decades in the making. We've been waiting for malaria vaccines for a while. And finally, we have 2 vaccines that have been approved by WHO, and one that is still ongoing in phase 3 trials. So there is the R21 vaccine, which was the first one to meet a WHO technology roadmap goal of a vaccine, and it has at least 75% efficacy. Then there's the RTSS vaccine, which has just been part of a pilot program, and you will find that it has been rolled out in those pilot countries. You may have heard about it in Ghana, in Malawi, in Kenya, and Gavi has also been allocating some vaccines for additional countries. So this has been a really good and anticipated step in the direction towards malaria elimination. However, it is still important to note that it will likely not be sufficient for eradication. Vaccines by themselves are unlikely to achieve malaria elimination because there are some challenges. For example, there's limited production capacity, how many can actually be produced given the demand that would be required. And of course, the allocation policy has to come into place of who gets the vaccines and who doesn't get them first, as well as, of course, figuring out how we're going to get to the centers where the vaccines are being given, and that so many doses have to be given. So there's some challenges, and we need to continue innovating. So another one that's really interesting and that's quite promising to fill in some of these gaps, there is the gene drive technologies. So gene drives are tools that enhance the chance of a specific gene being passed on to an organism's offspring, which means that that gene spreads out throughout the entire population. So this is effectively called driving the gene. So we say that gene is being driven to progressively increase its frequency in the population. And that means that whatever change we have introduced is able to spread faster and remain effective for longer. There is a really good TED talk that has been given about this by Professor Abdoulaye Diabate, How to End Malaria, and this will go live on Tuesday, August 20th at 3 p.m. GMT. So please do tune in and listen to more about this innovative technology. I'm sure there'll be a lot of very useful information for all of you.
Thank you so much, Krystal. We're very excited to see Professor Diabate on the TED stage talking about gene drive technology. I will now thank you all so much for these great presentations. I want to move to the Q&A session now. So journalists, your presence, by the way, I wanted just to tell everybody that we have journalists from Kenya, Uganda, Cameroon, Nigeria, Burkina Faso, Côte d'Ivoire, Senegal, Tanzania. The continent is represented. Thank you so much for supporting us in this work. So we do have a question from Samuel. So Samuel, who's based in Uganda, is interested in getting more statistics from malaria, the number of cases recorded by the Ministry of Health, and who are most affected. Krystal, I don't anticipate you to have these figures at the top of your head. So Samuel, what we will do for you is we will email you the response, if this is fine, because this requires us to look through some stats. But then there's another question that he's asking is, are people near Lake Victoria shoreline at risk? Is there a need for alarm? And which region in Uganda is most affected? And again, the number of deaths. So Krystal,
yeah.
Please.
Thank you for that question, Samuel. So while we will look through and give you the more, the definite, accurate statistics, what I can tell you is that Uganda is still in the top 5 countries that are contributing to the malaria burden worldwide. We're talking about 5% of cases coming from Uganda alone. And an increment actually was recorded according to the most recent World Malaria report, which is the most commonly used source of malaria statistics. You did ask whether these cases are coming from MOH or Target Malaria. So Target Malaria is a research organization working to create an innovative solution to reduce the number of mosquitoes that spread malaria, but we are not the ones who are recording malaria cases. So that is coming from, yes, partly Ministry of Health and other reporting systems that the WHO then puts together, and you get this report. So the most recent report, which is the 2023 World Malaria Report from WHO, did show that we had an increase in the number of cases in Uganda, over 500,000 increase between 2021 and 2022. So we do have quite a significant burden here in our country, which I'll send you more figures. And of course, people who live in areas where you have more water sources are going to be at slightly higher risk than the rest. But because we are a tropical country, actually most of Uganda is at high risk for malaria. Over 90% of the population is at risk of malaria. So while I would say that it's true that there might be conditions in certain areas that make it a higher risk, the truth is that the whole country is actually at high risk.
Thank you, Krystal. Just to answer some of Dr. Phillip, did you want to add something to this question? No? Okay.
No, I think Krystal did justice to it.
Okay, great. Okay. Just answering a question that we had earlier on from a journalist, Benga, based in Nigeria. So the first speaker, the opening remarks were by Dr. Michael Charles, who's the CEO of RBM Partnership to End Malaria. I also want to make sure that everybody knows you receive a press kit with obviously our speaker's profile, along with a press release and a recording of this session. Let's move on to the next question we have here from Naftali, who's from Chigiya News Agency. Thank you for joining. And the question is, kindly provide the statistics on dengue fever burden in Africa, and could it be that climate change and mutations of Plasmodium is fueling malaria in non-endemic parts of Africa, like cities, cold highlands? Dr. Phillip Chigiya, would you like to answer this question?
Thank you very much, Lauren, and thank you for the question also. I do not have the statistics offhand, and I'm sure the team is able to lead you to the right resources for that. In terms of dengue, malaria, and climate change, it's a very complicated area, and there's a lot of work and research that is being conducted there. And I mean, there is already evidence that there is potential links between the two, climate change and these diseases. For example, just last year in Pakistan, there was a surge in cases of malaria because of the floods that happened there. And the floods were said to have happened due to climate change. So it's very possible that in the future, climate change could have a direct impact on that. But it's very complicated, and there's a lot of research going on, and we look to the scientific community to keep on looking at it, and so that we can have answers and we can be prepared for the threat of climate change. Thank you.
Thank you so much. We do have a question from Musa Issa. I will ask it in French. Dr. Charles Guissou, if you want to answer that in French, you're welcome to do so. Depuis quand la maladie de dengue a été découverte en Afrique? So just for our Anglophone journalists, the question is, when was dengue discovered in Africa? Dr. Charles, can you answer this question? Vous pouvez répondre?
Okay, merci beaucoup, Eloïne, et merci à Moussa pour sa question. Il faut dire que les épidémies de dengue en Afrique ne sont pas aussi récentes. C'est depuis des décennies que nous voyons ces épidémies avec des ampleurs différentes. Donc, ce qui fait que, mais particulièrement, je vais prendre le cas du Burkina Faso, nous avons eu une autre grosse épidémie de dengue, c'était en 2013. Et ensuite, en 2016-2017, nous avons eu une autre épidémie de dengue. Et celle de l'année passée, en 2023, était la plus meurtrière en Afrique. Parce qu'au Burkina seul, nous avons enregistré plus de 150 000 cas de dengue et plus de 700 décès. Donc ça, c'est des données du ministère de la Santé du Burkina Faso. Donc, ce qui montre que de plus en plus, les cas de dengue deviennent de plus en plus fréquents en Afrique et dans beaucoup de pays. Donc, ce qui, en tout cas, donne à réfléchir sur, en tout cas, les moyens nouveaux de lutte antivectorielle contre la dengue et contre également aussi d'autres maladies transmises par les moustiques. Merci.
Merci beaucoup. Thank you, Dr. Charles. We have a question here for you, Krystal. Are there invasive species of mosquitoes in Africa?
Yes. Currently, when it comes to malaria, the invasive species that we have is Anopheles stevensi. Anopheles stevensi has been historically found in parts of Asia, but has been rapidly invading parts of Africa now. So that is the most outstanding invasive species that we have at the moment.
Question from Mathieu Sanda. Mathieu, merci beaucoup d'être ici. La question de Mathieu, c'est depuis la découverte de l'anophèle femelle en 1897, une importante découverte. Pourquoi la recherche piétine en matière de recherche et de technologie? Pour Dr. Charles.
Et ça, c'est vraiment une question pour les entomologistes.
So, Krystal,
Oui.
the question is, since the discovery of the Anopheles female in 1897, which is an important discovery, why is the research and the technology taking this long?
There is a number of factors, I think. It's not just one factor. So when we discovered the link between mosquitoes and spreading malaria, that drove the innovation of certain tools that would protect people from mosquito bites at night. For example, the mosquito net and the insecticide spray. And this had a big impact. So for some time we were happy, we were seeing a change, we were saying we will get there, and we set all of these goals. However, over time, the mosquito has proven to be a bigger fighter than we expected, especially for us who live in tropical areas where it's hard to get rid of them. The environment is so good for mosquitoes. So there has been resistance to insecticides. So over time, you have found that less and less mosquitoes are responding to certain insecticides. And it's very difficult to pass a new insecticide. So over time, it took a very long time for us to have even a new insecticide, over decades before we've had the newest one. The nets, some of the mosquitoes have changed behavior where they start now to bite before people enter the net, or to wait for someone to get out of the net and they bite them in the latrine. There have been invasive species. There is climate change that is creating, that is letting mosquitoes survive where they never used to. So there are all these challenges that have been coming up. And I think we got a little bit comfortable with the tools that we had. And then when we saw that we are really beginning to flatline, we're going nowhere, is when innovation woke up again and we're saying, okay, can we have some vaccines? Can we have some gene drive? Can we do more to catch up to this epidemic? So we are hopeful that if we are able to embrace all these new technologies and developments, we shall be able to achieve malaria elimination. But of course, the challenge of evolution and adaptation has been a problem in the fight against malaria.
These are very smart animals, unfortunately. We have a question from Jean Bessan Mangan, based in Cameroon. If we consider malaria and dengue fever as diseases linked to poor hygiene conditions, will these diseases disappear if we manage to clean up the environment? Dr. Phil, do you want to answer this question?
Yeah, I think that's also a very pertinent question. I mean, like what Krystal was explaining, that there are several methods of vector control, and definitely hygiene is part of it. And usually when you're talking about that, is vector control is draining the swampy areas around homes, making sure that we reduce the mosquito breathing places. Breeding sites that are around places that are habited by people. But it's not as simple as increasing hygiene and then it disappears. So because of how the climate where we live in, especially in tropical and subtropical regions, it will not be as straightforward as that. But it's a very important measure in terms of what we do in controlling the vector, and it has to be done. But also one thing we have to keep in mind is that there is no panacea, there is no silver bullet solution when it comes to tackling malaria. Everything comes together when you're tackling malaria. We need to make sure that people are treated. We need to make sure that the vaccine is given to those who are eligible for the vaccine. We need the gene drive technologies. We need to make sure that people are sleeping under bed nets, and all those things together, including the hygiene that you are talking about, will get us there where we want to have a world free of malaria. Thank you.
Combined efforts. And Dr. Phillip, stay here for us because we have another follow-up to this question. So there are reports that the malaria parasite is resistant to drugs. What are the latest innovation on anti-malaria treatments?
Indeed, over time we have seen that there has been resistance to anti-malarials over time, different classes of them. And right now also there are reports that are coming from places and places. I'm not the most qualified person to be speaking about this because I'm not there, but what I can say is that it is important that we have surveillance mechanisms in place, because what is surveillance is that it's the systematic monitoring of diseases around and their epidemiology. So when we figure that there is resistance popping up in one area, then we can get in there with measures, then we can do measures and make sure that the resistance doesn't spread, because our tools are only limited and we need to pick up this resistance as soon as it comes about. And it's also very important that we are good stewards of our medicines, which is why it is important that when you're sick of malaria, you get to a facility and you're treated when you need to be treated because of that. But it is very important for countries to strengthen their surveillance mechanisms and prevent the resistance that we have known to be there and is still ongoing in this day.
Thank you. Krystal and Dr. Charles also wanted to add to this the work that Target Malaria does in terms of gene drive innovation. I know we ran through this quickly towards the end of the presentation, but maybe it's a good time now to explain to our journalists what the technology is about. And how that could really help preventing further infections.
Did you want me or Charles?
You open your mic quicker. One.
Oh, okay, so briefly, Target Malaria is working with using genetic modification with gene drive technology. So what that means is we're looking at this mosquito that spreads malaria and saying that let's find a way to control that mosquito using mosquitoes. So we're looking at two major routes. The first one is that we modify the mosquito so that the female mosquitoes lay less eggs. So a female mosquito can lay 200 to 300 eggs every time it lays, and it can do this over and over. So it really creates a large number of mosquitoes that can spread malaria. So if this mosquito are modified so that it's only laying, say, 10 eggs, that is a very big difference. And then that would mean that over time, the mosquito population numbers would fall, which means that would interrupt malaria transmission. Now, the other option is to have what we call a male bias. So this means that mosquitoes, when they go to lay eggs, usually they will have 50% male, 50% female, half and half. So if the 300 eggs, 150 would be female. Now, we would want to introduce a change, which is called if we're saying it's the male bias, which means that instead of 150 being female, now maybe you have 5 female and the rest are all males. So male mosquitoes don't bite. But also if you have female mosquitoes to reproduce, that means over time, the mosquito population would fall. And this suppression would mean that malaria transmission is interrupted, which means that you have less malaria in the environment, in the population, because there are less mosquitoes available to spread malaria. So this method would be able to work with the existing methods where you have the gaps that have been making it difficult for us to reach malaria elimination. So the nets can protect you indoors. And then when you're outdoors, the mosquitoes are fewer, so you still don't get malaria and that kind of thing. So I've tried to simplify the method, and we add something called a gene drive to make sure that our change remains there. Without a gene drive, we'll have that change today, and then the children of those mosquitoes will go back to producing very many mosquitoes, all male and female. So with a gene drive, it makes sure that even the offspring of those ones have the change, and so on, so that we need fewer releases. It would be more sustainable, more cost effective, and hopefully we can achieve our end much faster.
Thank you so much, Krystal. Just for language purposes, and we will end this webinar in the next three minutes. In French, we talk about impulsion génétique when talking about gene drive. Thank you so much, Krystal. We have a question for you, Dr. Guissou. Now is the rainy season in Burkina Faso. How is the country and the health system dealing with upsurge in malaria cases?
Okay, merci beaucoup. Elohim, au niveau du Burkina Faso, à travers le ministère de la Santé, il y a des actions, en tout cas, de lutte, de prévention du paludisme. Il faut savoir que nous avons, depuis le début de l'année, introduit, par exemple, la vaccination des routines, le vaccin contre le palu, donc RTSS, dans le programme de vaccination pour les enfants de 6 mois à 59 mois. Donc, ça, c'est une effectivité. Et aussi, au niveau du traitement préventif chez la femme enceinte, ça aussi, c'est un programme qui se déroule. Donc, toutes les femmes qui sont enceintes, qui se présentent dans un centre de santé, automatiquement sont mises sous traitement. Il y a aussi pour les enfants de moins de 5 ans. Donc, et nous poursuivons aussi avec la distribution des moustiquaires imprégnés d'insecticides et dans certaines régions la pulvérisation intradomiciliaire. Donc, toutes ces actions mises ensemble avec également les actions de communication, de sensibilisation sur les bonnes méthodes, c'est-à-dire au niveau de l'hygiène, de l'environnement, que les gens puissent détruire les gîtes larvaires, qu'ils puissent nettoyer autour d'eux, qu'ils puissent éliminer tout ce qui peut être source, en tout cas pour les moustiques, pour qu'ils se développent. Donc, toutes ces actions mises ensemble, on essaie, en tout cas à travers le ministère de la Santé, d'avoir carrément une action coordonnée. Donc, malgré tout ça, ce n'est pas suffisant. C'est pour cela que nous sommes conscients que la recherche et le développement de nouveaux outils de lutte antivectorielle sont nécessaires, tels que l'impulsion génétique. Donc, et également aussi la recherche aussi sur d'autres outils tels que le vaccin et d'autres formulations d'insecticides, parce que la lutte n'est pas seulement unidimensionnelle. Il faut plusieurs outils pour arriver à une réduction massive, en tout cas, de la prévalence et de l'incidence du paludisme.
Yes.
Merci.
Dr. Guissou is talking about different tools, using all the tools that are currently available for us. So just to answer quickly your question, Temitope, yes, indeed, the mosquito nets are one of the tools that should be used. I want to thank everybody so much for being part of this webinar today. Please help us. You know, we have this hashtag for so tomorrow, reminder tomorrow is World Mosquito Day. Please use this hashtag whenever you're, you know, sharing your articles. Hashtag Zero Malaria starts with me. Stay in touch. We certainly will. A big thank you to our panelists. And any questions you have, please just let us know. Have a beautiful day. Thank you all so much. And be on the lookout for the video for the TED Talk that is coming out tomorrow by Professor Diabate. We're excited for this. Thank you all so much.
Thank you very much.